Bone augmentation and implant dentistry, enhancing bone density for success. Implant dentistry has revolutionized the way we approach tooth replacement. With advancements in technology and techniques, dental implants have become the gold standard for replacing missing teeth. However, not every patient is a suitable candidate for dental implants due to insufficient bone density in the jaw. This is where bone augmentation comes into play. What is bone augmentation? Bone augmentation, also known as bone grafting, is a surgical procedure that helps enhance the bone density in the jaw. This procedure is necessary when the jawbone has deteriorated or lacks the necessary structure to support a dental implant. By adding bone grafting material to the affected area, the bone density is increased, providing a solid foundation for the dental implant to be placed. Why is bone augmentation important in implant dentistry? Bone augmentation is crucial in implant dentistry for several reasons. Firstly, a strong and stable foundation is essential for the long-term success of dental implants. Without adequate bone density, the implant may not fuse properly with the jawbone, leading to implant failure. Secondly, bone augmentation allows patients who were previously deemed ineligible for dental implants due to bone loss to undergo the procedure, improving their oral health and quality of life. Types of bone augmentation procedures. There are several types of bone augmentation procedures used in implant dentistry, depending on the extent of bone loss and the patient's specific needs. Some of the most common bone augmentation techniques include bone grafting. This involves taking bone from a different part of the patient's body or using synthetic materials to fill in the gaps in the jawbone. Sinus lift. This procedure is performed when the bone in the upper jaw is too thin to support a dental implant. The sinus membrane is lifted, and bone grafting material is added to increase the bone density. Ridge expansion. This technique involves making a space in the jawbone and adding bone graft material to widen or heighten the ridge to support a dental implant. Socket preservation. This procedure is performed immediately after a tooth extraction to prevent bone loss and preserve the socket for future implant placement. The success rate of bone augmentation in implant dentistry. Bone augmentation has a high success rate in implant dentistry when performed by a skilled and experienced oral surgeon. According to studies, the success rate of bone augmentation procedures ranges from 90% to 95%, depending on the technique used and the patient's overall health. With proper postoperative care and follow-up appointments, patients can expect a successful outcome and long-lasting results. Factors affecting the success of bone augmentation. Several factors can affect the success of bone augmentation in implant dentistry. These include patient's overall health. Patients with certain medical conditions, such as diabetes or autoimmune diseases, may have a higher risk of complications during the bone augmentation process. Smoking. Smoking can impair the body's ability to heal properly after surgery, leading to a higher risk of complications and implant failure. Bone quality. The quality of the bone in the jaw can impact the success of the bone augmentation procedure. Patients with poor bone density may require additional treatments to improve the bone quality before undergoing dental implant placement. Surgeon's experience. The expertise and experience of the oral surgeon performing the bone augmentation procedure play a significant role in the success of the treatment. Patients should choose a qualified and reputable oral surgeon with a proven track record of successful outcomes. Bone augmentation is a vital component of implant dentistry that helps enhance bone density for the successful placement of dental implants. By undergoing bone augmentation procedures, patients can overcome bone deficiencies in the jaw and achieve a beautiful, healthy smile that lasts a lifetime. If you are considering dental implants but have been told you lack sufficient bone density, consult with an oral surgeon to discuss your options for bone augmentation and enhance your chances of a successful outcome.